Assalamualaikum warahmatullahi wabarakatuh, the honorable educators, committee, and audiences. We have been knowing that now people all around the world are facing the COVID pandemic, and I wish this pandemic will end soon. Now, here are the questions. Have you ever talked about in healthcare system in Indonesia? Is it fair? Is it affordable for lower middle class society? To answer these questions, we need to dive deeper into the issue. Ladies and gentlemen, I believe this issue is related to the COVID pandemic issue. There are so many problems that were caused by this pandemic. In Indonesia itself, there are a lot of COVID patients that have not been handled properly. And this problem seems to happen not only in the COVID pandemic situation, but in normal situation. This happened because of the minimum number of medical personnel and healthcare, especially in the remote area, which have the same rights to access healthcare as in the cities. Ladies and gentlemen, when I was 7 years old, I was on vacation with my family in some place in South Sulawesi. And it was very remote area. And the location is far away from the city. And unluckily, that time my sister had diarrhea and was already too dehydrated. My whole family was very worried because there were no premises or medical personnel. That was very disappointing and very sad for me. And what would be happen if one of the residents from the area or tourists experiences the same thing as my sister? Or even worse, do they have to cover very long distance and very long hour to get a treatment? If it's so, then I believe it will be unfair. Ladies and gentlemen, if we compare to several neighboring countries, in Indonesian healthcare is far below the standards. In Indonesian service system is still differentiated between high income patient and less income patient, which can be proven by opening classes for patient. VIP class patient will be served with privilege, while less income patients are not. Are these gaps between the service system is correct and fair enough? In my opinion, the hospital prefers the patient who have the money more than patients who use the public health insurance or Jamkesmas. Even though they are in a stage of dying, they must be willing to wait after the patient who have the money. Discrimination in terms of services is what makes me very disappointed with the government performance, especially in the health sector. As Indonesian citizens, we can do several things to help our government to develop and fix this issue. For example, first, cooperating with the investor who are willing to provide the health facilities and infrastructure, especially in the remote area. Second, help to educate the below community member about the importance of hygiene and health so that they can realize how expensive health is. And I hope that government in the future can provide the adequate public facilities such as health centers that can reach the middle to lower class and can provide free services for healthcare and also providing free medicines for the poor citizens. Ladies and gentlemen, I think that's all of my speech. I hope my speech is useful for all of us. And I don't forget to thank Allah Subhanahu wa Ta'ala and to the IREC Commit for organizing this competition. Greetings for me, Namira Anandita from SMA Negeri 2 Makassar, Team F. Remain safe and remain healthy. Wassalamualaikum warahmatullahi wabarakatuh.